Somebody was speaking this morning about this is the worst of times. We have had the worst of times several times in New Jersey. So let me remind you of a couple of other worst of times. The year after Dr. King's assassination, grim for economic and community development in terms of trying to figure out a path forward over what became increasingly divided racial lines. Another period of slight depression, the midterm phase of the Carter administration. OPEC oil prices went off the charts. They had to balance the budget. How did they do it? Largely by cutting the hell out of domestic social spending. I said that Jimmy Carter should live to be 200 years old because only if he lived to be 200 years old and worked every day for Habitat would he ever replace the number of housing units that we no longer have due to the current budget cuts. So I'm praying for good health for the president. And then, of course, we have the extremely dark years of the Reagan-Bush cuts, which we all know about, which reduced from its peak the HUD funding nearly 50%, or perhaps even more than that, and then Bush 2 cuts. So, what are we going to have to do to position ourselves to take advantage of what I think might be an opportunity to reintroduce a lot of New Jerseyans to the neighborhoods that you are working, both future residents, small businesses, and finance community. We heard a lot of it over the morning, so I won't take up a lot of time. But one is obviously we have to continue to diversify our funding base. And we have to look at a variety of alternative funding sources. This year, here are a couple of the funders that are involved in the community development projects I'm engaged in. One in particular is taking a used public transit bus and converting it into a mobile farmer's market. And here's who's financing this project. Number one, we got the MATA bus company, the Regional Transportation Bus Company, to give us the bus for nothing and actually fix it before they gave it to us. Give us all their vendors who they spend millions of dollars with that we could go and talk to about contributing to our bus, which is very good. And then a local NBA team that will remain unnamed, but has a nickname that would be very odd for a southern state, the Grizzlies, came and asked us, we think this is a great idea. We have a little public relations problem over canceling half the NBA season. What would it cost to wrap your bus with a big Grizzly and make it the Grizzly Healthy Food Express? My initial response, and thankfully I learned a little bit from Michael, I didn't respond. I said, let me get back to you. I thought $10,000 would be a nice number, right? And for $15,000, I would allow the mascot to actually drive the bus. Well, it turns out that the bus company gets $96,000 a year from companies that get exclusive advertising of a single bus. Because ours isn't going down one route, but every route in the city over a 6-day period, we're getting $125,000 from these nice people from the Grizzlies. Then we have a pharmaceutical company that's the #1 provider of diabetes equipment, information, and services. They heard about our Healthy Food Bus, and they wanted to know if they can rent the back quarter of our bus to actually have a diabetes information service, because they're really looking for ways to better connect in low-income areas where the diabetes rate, particularly diabetes 2, among children is off the chart. So we're going to have the back of the bus is actually going to be turned into a health and wellness center funded by a local pharmaceutical company. In my wildest imagination, I wouldn't have imagined that to be the case. So we have to diversify our funding sources. Second, I think we have to resist the notion under tight times of pulling back from our community outreach and organizing work. Because as money gets tighter and tighter, very well organized and financed interests will be able to make their voices heard in Trenton, despite all the ballards in front of the State House now. I think they still allow picketing, at least across the street. The senior citizens I work with, we had the record of being held in 17 permits in a row for occupying that space, so it has a special meaning to me. But to continue our community organizing and participatory planning so that we continue to build a political base, nonpartisan, in order to keep state, federal, and private interests in an even keel in terms of their approach to equity-oriented development. And then I think this group has already pioneered this, but for a lot of groups, the notion of going beyond a very narrow housing agenda, maybe housing and neighborhood-oriented retail, is something that's a little daunting in difficult financial times. But I think increasingly funders and the community are demanding groups that have capacity, like many of the CDCs in this room, to think about other critical areas of community development. One that's very important for us in Memphis is urban food security. We are the Sahara of food deserts. We've just helped set up a network of 17 farmers markets. We now have a citywide community-supported agriculture program. We're doing the Healthy Foods Bus. That will start June 1st, sponsored by our favorite NBA team. I have to say that every time under the agreement. And we're keeping detailed data, and we're in a relationship with several consulting firms that do location for supermarkets, because we want to demonstrate to them that these neighborhoods have effective demand and that they can make money providing full-service supermarkets in our neighborhood. And then if they choose not to, we're going to look at a producer-consumer co-op with the help of the National Cooperative Foundation. Another area that's becoming increasingly critical, and as a planner who's approaching 60, this is not part of my training at Hunter College back in the day, and that is to look at not only the food desert issue, but the primary care desert issue. In Memphis, in the two neighborhoods that I'm currently working in, two sections of the city, 3 square miles, there's not a single primary care doctor, dentist, and there's 3 social workers and 1 connected to local schools and 4 in another. And when you look at the health status of young people, this is an alarming problem that we have in many of our neighborhoods, even though insurance may be, or publicly assisted insurance, more available, the absence of providers. And I think community development corporations are going to have to get into that business. Energy, we talked about earlier this morning. And then I loved Ray's discussion of the insurance business. I think Ithaca has a long-standing community-based health insurance program that's worth taking a look at, that covers a lot of folks for routine kinds of health episodes, and that the nonprofits in Ithaca have taken advantage of that. And then last but not least, a little different take on the creative economy, which is the Richard Florida's notion. But we're increasingly doing work in Memphis around taking advantage of the remarkable cultural history of the city, where Stax Music was located, High Records is located, etc. And we have many of the homes of the original blues men and women to actually use that to support the economic and community development of a neighborhood called the Soulsville neighborhood. And we call this project the Memphis Music Magnet. So those are a couple of the things I think we have to do. It suggests some changes in who we recruit to be our staff persons, who we recruit to be our board members, who we recruit to be our volunteers. We have to have folks that go beyond the traditional, I think, city planning background or housing finance, but also look at folks who have very sophisticated understandings of management and nonprofit and public management, and also communications and revisiting our commitment to hiring organizers. That means we're going to have to also think about where are these people coming from. And right now, because of the cuts in public education, many of our students leave undergraduate and graduate school with absolutely oppressive debts. And it makes it difficult for them to consider going to work. The only job in community development they could afford to take is Ray Acasio's, or Alan Malik's. And we all know Alan's not going anywhere for the next 50 years. So we have to think about how we begin. And one of the things I noted, maybe because carpenters always see problems as hammer and nail problems, but I noticed that in our session today, there are very few people here from the universities. And we have to think about how, if we begin to look at the aging of the baby boomers, many of us are going to be heading to retirement out there in Cranberry. Who is going to be coming in our place, and how does the network have an intentional system strategically working with those universities to make sure they're in shape? Last couple of things I'm going to comment on is something that you probably know, but a lot of folks might view as somewhat counterintuitive or just plain crazy. For years, we've been talking about the need to build the capacity of nonprofit organizations and institutionalize our ability to organize, plan, and do development. While we were busy doing that, which I think we've done a remarkable job, particularly I think the people here in New Jersey through the network and other institutions, one thing that we failed to notice is the rapid deterioration in the organizational capacity of municipal government in New Jersey. So think about it. I hate to pick on Ray, but Ray's been in Newark since the first brick was struck. His agency has 200 folks, that many of them come from the community, they're connected, they're held accountable, and they're working with a relatively new administration that's trying to build their capacity. Think about Patterson, where the Community Development Corporation, in many ways, the nonprofit organizations, although with limited resources, have to partner in order to access federal funds, and sometimes that's required in order to get private sector investment with municipal government agencies whose housing and community development units have been gutted. So one of the things we have to think about is how do we assist our brothers and sisters who are on the other side of the fence from us in terms of public development to rebuild that capacity. So those are a couple of things. I guess the question then is, are we able? That's what they ask in the African American church. And I think if you just reflect a little bit on New Jersey's history with the network and the nation's community development history, that this network of folks, because I think of the deep commitment and passion for social justice, the resilience of these organizations, that funding has never been guaranteed and assured. You've always had to be nimble and be willing and able to shift your agenda and priorities, have developed extraordinary organizational capacity, which I think bodes well for its ability, once the economy begins to rebuild a little bit, to take advantage of some of the opportunities that I mentioned.